everyone, welcome to 2-Minute Tuesdays. We here at Patient Safety Learning every Tuesday this month are going to be hosting a session on patient safety, and we're going to chat for 2 minutes on any hot topic. My hot topic this week is about guidance in a time of flux, and what I mean by flux is our environment is totally changing all the time in hospitals, and I just wanted to find out what your views were on and how you're coping with making people adhere to guidance where you work. So my name's Claire, I'm the Associate Director for Patient Safety at Patient Safety Learning, and I'm also a critical care outreach nurse in Brighton. And I feel when I go to work it is like I'm a new girl all the time. Every time I turn up, something new has happened, a new piece of guidance, a new protocol, a new way that we're going around, even just walking around the hospital has changed. And it made me think, how are we going to adapt our guidance? Because what we do now is completely different to what we did before the pandemic. An example of this is when I taught on a recent advanced life support course, and we were teaching the resus guidance as we normally would, but it didn't reflect how real life was being acted out now. So in the guidance it says that we've got to push on the chest as soon as we can once we've confirmed cardiac arrest. But now we have to not do that, and we have to get dressed in PPE before we can do anything. But the guidance was telling us that we didn't do that, and it gave a juxtaposition of, well, what should we be doing? So the Resus Council say that we should be wearing PPE for doing CPR. However, Public Health England have said that it wasn't. We don't have to use the full PPE. So which is right, and who do we choose to trust? And that sets up a worry about clinical effectiveness and governance. What should we be doing in these times of changing, changing environments? And it takes a long time to write guidance as well. So how can we make sure that what we're writing is up to date and evidence-based? I've also found when I did the teaching that hospitals were doing different things to each other. So they were adapting policy and guidance to what was working well for them. But how do they know that that was safe in that hospital? And how can they share knowledge of best practice? So I'd really like to hear your thoughts on what you have been doing in your area to make sure that the guidance and the training is up to date and is evidence-based practice in a time of flux. If you'd like to leave some comments in the link below, that would be fantastic. Thank you.